Hello, this is Mary from ICU. I'm going to show you how we do our documentation in the intensive care unit. So in addition to the ones that you have watched, these are the few more documentations added when you come or float to the ICU. When you admit a patient, you have to connect your heart monitor to the ARCIS. And to do that, under the patient shortcuts, you'll find Device Connect. So click on Device Connect and it will bring you to this screen. You are to get your scanner, which is located on the wall, and scan your heart monitor so that it will get linked to ARCIS. But in the meantime, I'm going to do this manually since I'm not in the ICU right at the moment. If you notice, this little icon of heart monitor appears. So once you have scanned your heart monitor, this will show you that your monitor has been connected to the ARCIS. And to start recording your vital signs, what you do is you click on charting group, and when you see this plus sign, you are to click it so that it will turn into a negative sign, and then you can start recording your vitals. To record your vital signs, what you need to do is click on the top of the column, and as you can see, all the vitals has been highlighted, and what you do is you click chart so that these vitals will be transferred into the ARCIS. Now it is very important to highlight and chart these vitals, for that is the only way for these numbers to be moved to the ARCIS program. And then after that, there are more fields you need to fill up by clicking bedside numbers. So to do that, you have to click on the cell, right click, and then you process event. And then you have to click correct supplement and then supplement. And other items you need to fill up are the number 4, which is the rhythm. So you click that and then click number 1 if it's a normal sinus rhythm. And then the next one would be the pain. So you have to scroll this down. And then you have to click no if patient is not in pain. And then you enter OK 3 times. And then the next one would be the number 18, which is your monitor alarm. This is just to record whether you have your monitor alarms on or not. So you click yes and then enter. And then what you do next is, if there are any more fields you need to fill up, so please feel free to put the data, and then click OK and then accept. So that is how you do your vitals on the ARCIS by using Device Connect. Other documentation we need you to do is your hourly intake and output. So you can find your hourly intake and output on the tab up here, and then you click that. And in the intensive care unit, we do hourly intake and output. On the left screen is where you are going to do your documentation, and then after your documentation, you'll find on your right screen your intake and output trends. All right, let me show an example. So right now, let's say you want to document your 12 o'clock intake and output, so you put 12 and just click enter. And on number 1, your IV solution, you click that, and then it says you're incomplete. So let's click number 1 and see what solution is in place. So there's an IV solution of D5.5. Now, if you have that running on your volume, you put in 100 cc. If you have 100 cc, of fluid ordered, and then you click OK. And then if you have any drips running, you click number 4. You click OK. So there you go. There's an insulin running. Then you just put 1 cc if you have that insulin drip running at 1 cc or 1 unit per hour. Then you click OK. All right, and on number 11, you have a Foley catheter. You just put in your urine output. So put 100 cc, and then you click OK, and then another. And then also, if you want to describe the characteristics of the urine, you click yellow, and OK, and another OK. And so when you are done, all you need to do is click OK one more time and then accept. The next thing I want to show you is when you get a call from the lab or from the radiology for any critical results. You are to document this under unscheduled documentation, which is found under patient shortcuts. So go unscheduled documentation and find your critical results readback documentation, which is under number 14. So you click that and you click OK and just enter the time that you got the critical results, and then you click OK, and then you are to document if you got the results by phone, by fax, verbal, or written. So just click one of those, and then you are to enter the name of the technician that called you for the results. So fill up all these fields, and then you click OK, and then accept. Critical results should be reported to the physician within 30 minutes of receiving the results. Another documentation that is very important in the ICU is when you are notifying the doctor. And to do your documentation whenever you call the doctor is you can find this under unscheduled documentation. This is under number 13. So that's called physician notification S4. So when you call the MD for any kind of situation, so you just choose from all these options, or you can free text by clicking number 16. So if you have anybody or any patient that's having shortness of breath, so feel free to type in or choose from the other options. And then of course your assessment, you have to type in your information, which physician you contacted, and the time and date that you called them, and then the outcome. Now the next thing I'm going to show you is something that you want to use whenever you are giving report on the change of shift. And this is called the ICU S-bar handoff. And you can find this on one of the tabs. So this is the ICU S-bar handoff. And I want you to expand the screen on the left upper hand side. And this will actually, this is actually very handy when you're giving a report, because all the information you want to know about a patient is all here. Then the first tab, which is the patient care info, this will tell you, the history, the medical history, surgical history of the patient, and if they are on isolation, if they have oxygen or tube feeding, and the diet is there as well. And on the next tab, which is the clinical data, this will actually show you the latest vital signs of the patient and the latest labs, especially the CMP, CBC, and the coags. On the next tab, which is called Shift Review, this will also pull the latest information about the patient's level of consciousness, the admission weight, height, and the current weight, and the Braden score and the false scoring and the Glasgow Coma scoring is there as well. And on the next tab, physical status. So this will show you the patient's orientation or level of consciousness, what's the latest rhythm on the patient, what the breath sounds are, and how the abdomen is looking like. And on the next tab, we have ventilator settings. So this will pull information, with the patient's latest ventilator settings. And on the tubes and drains tabs, this will also show you what tubes and drains the patient is currently on. And on the S bar, if ever a nurse reports or calls the doctor, and if she did her documentation on the physician notification S bar, it will actually get pulled to this screen. And on the next tab, which is your ADLs or activity, so this will actually show you, the ADLs, prior to admission. And on the admission and health history, it pretty much tells you, your allergies and the admitting diagnosis and other information such as religion, and also the most important are your vaccine information, like as to when the patient last got their flu and pneumonia vaccines. And on the last tab, which is the registration and visit info, it will tell you your visit date, who the attending physician is, and also it will tell you the code status and if the patient has a pulse, and the language, the language preference of the patient, religion, and also the contact information of the patient. So that pretty much wraps up my ICU documentation. So again, this is in addition to what has been shown to you on the previous video, and this only applies to people coming to ICU and to those that are floating to ICU. Thank you.